I can help the next patient over here. Hi, how are you? Please have a seat. And are you here for a 1 o'clock appointment? Very good. Alright, and what is your first and last name? Perfect. And are you a new patient here? You are. Okay. And what is your reason for the appointment today? Okay. So just a normal cleaning and checkup. Perfect. So I'm just going to ask you a few questions in our database. Then I'm going to move on to some other questions related to this appointment and some medical history. Okay? So first of all, can you give me your street address? Okay, and what city is that? Okay. Perfect. And your date of birth? Alright. And then I need an emergency contact and their phone number. Okay. And what is their relationship to you? Perfect. And the phone number. Okay. And have you been sick at all recently? Okay, good. And what is your dental insurance? Okay, great. And then your primary care physician. Okay, can you spell that for me? Perfect. Okay, and what city is that in? And then when was the last time you were at the doctor's? Last year. Okay. And then, are you currently on any medications? Okay. Perfect. So I believe that is all I need for that portion. Now I'm just going to get some paperwork that I'll be filling out with you. Do you need anything before we get started? Alright, perfect. Here they are. Alright, so it's going to be a little bit about your health history and your dental history, and then also a little bit about your medical history as well, just so we have that on file. So we'll start with this one. Okay, let's see. So we have your emergency contact already. So let's start off here. What is your height? Okay, and then your weight. And your date of birth. Perfect. Okay, so we have that. Alright, I'm going to skip down to the dental information, which is next. Your gums bleed when you brush or floss? Sometimes. Okay. And how many times a day do you brush your teeth? Okay, 2 times. Is your mouth dry? Have you had any gum treatments recently? No. Have you ever had any braces or orthodontic treatment? Okay. And how long ago was that? Have you had any problems associated with previous dental treatment? Okay. And when was that? Okay. Alright, so let's see. Is your home water supply fluoridated? You're not sure? Okay, I'll just put that. Put a note for the dentist. Do you drink bottled or filtered water? Okay. And how much water would you say you drink every day? Okay. Alright, so are you currently experiencing any dental pain or discomfort? Okay. And what is the reason for your dental visit today, which we already know? A teeth cleaning and general checkup. How do you feel about your smile? Very good. So you feel great. Well, you have a lovely smile, so I agree with that. Alright, let me move over here. Do you have any earaches or neck pain currently? Okay. Do you have any clicking, popping, or discomfort in your jaw? Okay. And how often does that happen? Every day. Have you ever seen a specialist to talk about that issue? No? Alright. Well, the dentist might have some suggestions for you. I also deal with some clicking in my jaw, some grinding issues. So I know there is somebody who she would recommend. So make sure you bring that up. And I put a note here for you as well. Alright, and then the next question, do you grind your teeth? Which is yes. Alright. And how long have you been grinding? The past few years. Alright. Do you have any sores or ulcers in your mouth? Do you wear dentures at all? No. Do you participate in any recreational activities? Okay. And what is the activity? Very fun. Have you ever had a serious injury to your head or your mouth? Okay. And when was that? The date of your last dental exam, if you can remember. If not, just a general month is fine. 2 years ago? Okay. No, that's fine. Don't worry about it. It's recommended to go once or twice a year, but it's fine if you miss a year. It's just good that you're here now. And when you had that last exam, was it just a cleaning and checkup? Okay. And then I'm assuming that's the last time you had x-rays taken as well? Yes. Alright, so now we're just going to get on to a little bit more of medical history. Generally, would you say that you're in good health? Any medical issues? Okay. So none. Any change in your general health within the past year? No. Okay. And then the date of your last physical exam? Okay, so sometime last year. Okay. In the past 5 years, have you had any serious illnesses, operation, or been hospitalized? No. I know you briefly told me about the prescriptions that you're taking, but can you remind me what they are? Okay. Perfect. That is everything on this page. And then I just have a few more things to ask you on this page. And then we will be all set. I'm not going to ask you all of these questions, but there are some that are important. Alright. So let's see. And please excuse me if I'm taking a little while. This is actually a new patient form for us, so there's a lot to read through. Alright, so let's first go over your allergies. So, do you have any allergies to local anesthetics? Alright, so what about any allergies to aspirin? Okay. Penicillin or any other antibiotics? Sedatives or sleeping pills? Okay. Do you smoke or do drugs? Okay. And do you drink alcoholic beverages? How often? Okay. Do you have an allergy to metals? Latex? Iodine? Any animals or any food? Okay. Now I'm just going to name some health issues and just let me know if you've ever had these problems in your lifetime, okay? So, cardiovascular disease, congestive heart failure, heart attack, heart murmur, low blood pressure or high blood pressure. Okay. Do you have a pacemaker? bronchitis? Any autoimmune diseases? Asthma? Bronchitis? Emphysema? Sinus trouble? Tuberculosis? Have you ever had cancer? Chest pain? Diabetes, type 1 or 2? Any GI issues? Ulcers? Heartburn? Thyroid problems? Okay. Any history of epilepsy? Any sleep disorders? Okay, and what is that? Okay, just a general bad sleep. Okay. I'll put a note for the dentist. And I'm sure that's probably related back to your grinding that you do at night. So, yeah, like I said, the dentist will be able to help you. Do you snore? Okay. Any kidney problems? Osteoporosis? Any severe headaches or migraines? Yes. Okay. And when do you typically have them during the day? Okay. Okay. Has a physician or a previous dentist recommended that you take antibiotics prior to your dental treatment? Okay. Alright, and then last question, finally. Do you have any diseases, conditions, or problems that are not listed above that I mentioned that I should know about? No. Alright. I'm just going to sign the bottom of this. Very good. Well, thank you for being patient. I really appreciate you taking the time to go over all of this with me before your appointment. Just going to double check that we have everything here. So we asked about your allergies, all of your medical history, and then your address, we have all that. Your dental information. Again, I just marked off the things that I think the dentist should be aware of, so she'll have that. And then your other medical information. So everything is here and ready. So I'm just going to file this in here, and this will be taken to your room, which should be ready shortly. So the only other thing I wanted to mention is we will need to get some x-rays from you since you haven't had them in a few years. So one of my associates is going to call you back in a few moments to get those done, and then after that you'll be able to go back and start your cleaning. So you'll have a full cleaning, and then you'll also just have an exam, and the dentist can talk to you a little bit about your grinding issues which are giving you headaches. Yeah, she'll be able to recommend some things that might help you, especially in regards to teeth. Obviously, you don't want to wear down your gums because that would not be good for your future. Okay? Alright, so like I said, I'm going to drop us off for the dentist, and you are all set. So you can just have a seat right over there, and you should be called very shortly for your x-rays. And if you need anything, please just let me know. The bathrooms are right over there, and there's also water in the corner as well. Alright? Well, it was so nice meeting you, and I hope you enjoy your dental exam today.